We're in. Good afternoon. Welcome to the Board of Health meeting, December 19th. Please note this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's July 16th, 2022 signing of an act relative to extending certain COVID-19 measures adopted during the state of emergency, including the extension of the March 12th, 2020 and July 15th, 2022 orders suspending certain provisions of the open meeting law, general law, chapter 30A, section 20 until March 31st, 2023. This meeting of the Chatham Board of Health is being conducted in person and via remote participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling 1-508-945-4410, and the conference ID is 682-956-419 #, or you can join the meeting online via Microsoft Teams through the link in the posted agenda. While this is a live broadcast and it's simulcast on Channel 18, despite our best efforts, we may not be able to provide for real-time access. We will post a record of this meeting on the town's website as soon as possible. So I'll turn the meeting over to our chairman, Dr. Noble Hanson.
It shall be the policy of this board to conduct its meetings under the open meetings law so as to encourage public participation whenever time permits and as part of agenda item discussions. So today we have 6 items on the agenda, and first we'll establish a quorum. I think we have 2 regular members who aren't here, so both alternate members will move up for this session to be members. So we'll take a quorum. Carol Gordon?
Here, present.
Dick Edwards?
Here.
Carol Boyce?
Here.
John Beckley?
Here.
And Noble Hanson, I'm here. So the first variance is 40 Deepwater Lane. Engineering Works is the engineering firm, and are they here to present the case?
Peter?
Yes, I'm here. Can you hear me?
Yes, we can. Thank you.
Yeah, my camera is not working for some reason.
That's fine. We can hear you perfect.
Yes. So we're proposing a new septic system in front of the house, between the house and the front property line. The existing septic system consists of 2 cesspools that are in the backyard, very close to a vegetative wetland. And so we're proposing to modify the plumbing in the front and put it out directly between the house and the front property line. And that's forcing us into variances to keep it as far as reasonably possible again, from the wetland out back. The reason that we place it where we are is so that the system can occupy the area of the existing driveway, and by putting it further to the left front property corner, it would force relocating the water service for the house. So we chose to keep it right where it is. And the vertical separation to groundwater is about 12 feet. So
That's good.
we're outside the 50-foot buffer. Conventional septic system for a 3-bedroom house.
Okay, thank you. And what's the reason for the upgrade of the cesspools? Did they fail, or it's just?
Yeah, they're having to pump them frequently. They're in failure.
Okay.
And not to the point where they're pumping them, every couple of weeks, but they want to be proactive and get it taken care of. So,
And no additional bedrooms are proposed, so.
no additional bedrooms are proposed, correct.
Questions from the board?
Peter, John Beckley, how old is the cesspool? Just curious.
I'm not sure. I think the cesspool is as old as the house, but I'm not sure exactly when the house was built.
Okay. All right,
No.
thank you. Just curious.
Has to be before 1970.
Okay. Well, there certainly seems to be an environmental upgrade, without a doubt.
Yep, I would agree.
Yeah, and I would just ask routinely, so the location of the new septic system is at a maximum distance from the water resource area. Is that correct?
Well, it's not the maximum distance, because to do so would be to have to relocate the entire water, the water service to the house and wrap it around the septic system, and would have to remove, more vegetation in the front yard that we have to remove to put it in the footprint that already exists. And the additional distance that we'll gain would probably be somewhere in the order of 10 feet by pushing it over there. So it's more, in my opinion, the vertical separation that we're going to have isn't going to be changed. We're going to be, far above the groundwater in its location where it is. Not only that, the location where we're proposing to have the plumbing come out is more conducive to the system that we have right now, as it's shown.
Okay. You have Carol?
Yes, I just have a question on how this will affect the wetland resource area. You're asking for a variance of 39 feet instead of the 100 feet that's required. It's going to be 61 feet. How does that affect the wetlands?
It's going to be 61 feet, I think is what it says there. I think it's going to be a huge improvement over what's there. Right now, we've got two cesspools that are, I would think that they're probably in groundwater right now. So we're going from a situation where the cesspools are really impacting the wetland to a situation where the bottom of the leaching system is going to be 10 or 11 feet above the estimated high groundwater. So I think there's a huge benefit to this upgrade.
Okay, thank you.
Okay, other questions or discussion? All right, I see Ron Broman is here, so we'll switch Ron into the regular member, and Carol will be the alternate. So Ron, are you present for the quorum then? Yeah, okay. And then can I get a motion to, Judy has recommended approval with conditions. We can get her to read the conditions. Do I get a motion to approve?
I'll make a motion to approve.
And a second?
I'll second.
Okay, we probably could take a voice vote. All in favor?
Read
Oh, yeah, Judy, read the.
Okay, yes, so the conditions are the applicant should restrict the property to a maximum of 3 bedrooms and record the restriction on the deed at the Barnstable County Registry of Deeds and submit a copy of the executed deed restriction to the board. The engineer shall submit an engineered as-built plan, including as-built elevations with a written certification that the system has been installed in accordance with the approved plan, and no alteration to the floor plan of the dwelling will be allowed without further review by the Board of Health or its agent.
Okay, I think we can take a voice vote. All in favor, say aye.
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 All opposed, say no. Hearing none, the variance passes, so you should be all set.
Okay, thank you very much.
Thank you.
You're welcome.
Okay.
And next, we have a variance for 3 Oyster Drive. East Southeast LLC is presenting the case for the variance.
Dad.
And are you ready to present the case for 3 Oyster Drive? Yep.
Just about ready.
Your assistant, yes.
Old school. Absolutely. Good afternoon. For the record, I'm Todd Overidge at East Southeast. I'm here representing 3 Oyster Drive. There is an existing Title V septic system on the property that's a little bit low. We're proposing to take down the building, reconstruct the building, and we're bringing the system into as full conformity as possible. We're still requesting variances, basically the same variances that were approved for the previous septic, 3 feet from the lot line. Sorry to take it away from you, Channel 18. So 3 feet from the lot line, 4 feet to the dwelling. The leaching would be 3 feet and 3 feet, splitting the difference. We're 92 feet away from the wetland, and we're also requesting a 25% reduction in the leaching area. This is going to be a raised septic system, about 9 feet above grade. We're hoping that you can send a favorable letter to the Zoning Board of Appeals, because that's going to be a tough one for them to accept. They're not always happy when these walls have to go up, but when groundwater is as high as it is, or when the ground is as low as it is, there's not much choice in the matter. We are also proposing a denitrifying septic system on this. We have concerns that the two-bedroom septic system, reduced in size, won't last long enough. That denitrifying system will help lengthen the life and hopefully until sewer gets out here. If you have any questions, I'm happy to answer them.
So when I drive by this new system, it will be how high above grade?
It's about 9 feet above grade. Some of the grade out there is at 7, so it'll be 7 feet or so above grade on those sides. But where the carport is being proposed, where the driveway is coming in, that'll be about elevation 5. Fortunately, when you
Can I-
drive by, you'll be out here, and that's going to be in the back.
I just wanted to clarify that one of the reasons it has to be so high is because of our regulations, which state that the finished grade can't be any lower than flood elevation,
And what?
which is 14, I think?
Well, it's the design, it's 1 foot above the base flood elevation.
Right.
Or in the building code side, they call that the design flood elevation. So the base flood is 13, the design flood is 14. So the ground above this system will be dry during a flood.
And so the whole house will be lifted to meet floodplain issues as well, and then this is just gonna be sitting at the same elevation.
14-foot flood rise,
13-foot flood rise.
13. Now, the house will still be dry and the septic system will still be dry.
Except for the rain.
Theoretically.
But in a surge, they should
But
both.
in a surge,
They should both survive that flood.
correct.
Wow.
So this is in the area by
Little
Outermost
Beach.
Harbor, Little Beach.
Little Beach.
That floods regularly and will be flooding more as we go forward.
Yes.
So the existing system was clearly endangered.
Well, I'll tell you what, maybe I shouldn't say this, but when I'm driving by, I'm thinking to myself, these are the locations that science tells us we really shouldn't be rebuilding.
Right.
We really, we must begin to set back. But I know there's laws and pre-existing obligations and ownership rights that don't make that easy. But when you drive down there and you start looking at the design of all the newly redone homes, it strikes you as, you're building right in harm's way there. And it's just another big storm that could put everything back.
But when you look at a lot of the FEMA documentation, they'll show a neighborhood decimated, and then they'll show a deck standing or a house standing, and those are designed under the current regulation.
I
current design
understand,
standard.
I understand, but humans keep having this obsession to get as close to the water as we can, and,
Well, they're gonna be very close to the water. But one good thing about this is we would have had a big problem with this.
being flooded.
No, that this was a 3-bedroom house previously, even though it's called a 2-bedroom house, but it has a study that would, by our rules, have been called a 3rd bedroom. And so it's nice to see that they've redesigned it in such a way that it's no longer cheating. Now it's really a 2-bedroom house.
Very large.
It's a large bedroom, but it's still, a single room, whereas it was clearly what we would have called 3 bedrooms previously. And that would have created a big problem.
The system was permitted for 2 bedrooms with all the same, pretty much the same variances. The previous dwelling was permitted for 2 bedrooms.
Right.
With all the same, more or less variances that you're being asked to approve today.
But we're being more restrictive now, and we would
Right.
never have approved it as 2
No.
bedrooms.
Right.
Because that study has a narrow door, and it would have been, we would have called it a bedroom. So it's really good to see that it's now not
Yeah.
a problem,
Yep.
other than the water.
And the original design being two-bedroom, that was 86, 88. It was 2004 that you changed the definition of bedroom. So it was technically a two when it was permitted originally.
I've got a question. It doesn't relate specifically to this design, but if somebody has a house built in a FEMA floodplain, can they get homeowners insurance?
Sure.
Okay,
It might cost a little more,
okay.
but homeowners insurance doesn't cover flood damage. So if they want flood insurance, then they can
That's a
go
different
through the,
issue.
they can go through the federal program. They can go through Lloyd's of London. None of them are great. The federal flood insurance pays out 250,000 max.
Max, okay. All right, thank you.
Okay, other questions or discussion from the board?
The only issue I have is with the variance things, the back of the page where you say this covenant and a 5-bedroom deed restriction.
We'll
So
take
we-
it.
Yeah, I don't think we want it to be a 5-bedroom deed restriction. Paragraph 2 on the back.
Oh, yeah. Good, very good.
Good catch.
Now, if we could only fit a 5-bedroom septic on the property, because there's hardly room for
On
two.
3,300 square feet.
Obviously, that's a typo.
Yeah.
The 5 should be a 2.
It should be a two, yeah.
That's
It's a two-bedroom.
Okay, yeah, Judy has recommended approval as it improves the protection of the environment. So can I get a motion for approval of the variance?
I'll motion, I'll so move.
And a second?
I'll second.
Okay, and then Judy will have to read
Do you want to ask if there's any comments?
comments from the public.
I don't see any.
And if not, then Judy will read the conditions into the record.
So the applicant should restrict the property to a maximum of 2 bedrooms and record this restriction on the deed at the Barnstable County Registry of Deeds and submit a copy of the executed deed restriction to the Health Division. The applicant shall sign a covenant with the board agreeing to comply at such time as the town of Chatham through its Board of Health and/or Board of Water and Sewer Commissioners directs the connection of this property to the municipal sewer when it becomes available. This covenant and 2-bedroom deed restriction shall be recorded at the Barnstable County Registry of Deeds, and a copy of the executed covenant shall be submitted to the Board of Health. Throughout its life, the system shall be under an operation and maintenance agreement. The O&M agreement shall be for at least 1 year and may be with any mass certified operator of the appropriate grade that has received training by the company on the operation of the system. Effluent from the system shall be monitored at least twice per year for the first 2 years, preferably May and October. The effluent shall be field tested in accordance with Mass DEP standard conditions for secondary treatment units certified for general use, revised March 20th, 2015. In addition, a lab test of the effluent for total nitrogen to meet the performance standard of 19 milligrams per liter shall be collected and analyzed by a certified lab. Water meter readings are to be provided with the semi-annual report. If any of the field tests or lab tests fail, follow-up tests shall be conducted by a certified lab and an evaluation made by the operator within 30 days. After the required 2 years of testing, application can be made to the board or their agent for review and possible modification of the monitoring requirements. The applicant agrees to apply a minimum of 6 inches of compacted topsoil to all disturbed areas of the property. The engineer shall submit an engineered as-built plan, including as-built elevations, with a written certification that the system has been installed in accordance with the approved plan. No alteration to the floor plan of the dwelling or the engineered site plan will be allowed without further review by the Board of Health or its agent. This variance is granted pursuant to the State Environmental Code, Title V, and the Town of Chatham Subsurface Sewage Regulations, and is valid for 1 year from the date the Board of Health approval. A permit must be issued and work commenced during that 1-year period, or the variance shall expire.
Okay, I think we can probably take a voice vote on the motion. All those who approve of the variance, say aye.
Aye.
All opposed, say no. Okay, the variance
Thank you,
is
Mark.
granted for 3 Oyster Drive.
All righty, thank you. And if I may, for Mr. Beckley, they are proposing trellises on the side with vegetation, so it won't look as bad as a concrete pillbox.
That's good. Very good.
Okay, item 3 on the agenda is an update to the Mass Department of Environmental Pollution Title V changes, and I think, is Dr. Duncanson here to speak to that?
He does not appear to be here. He had another meeting that was conflicting, so he must not be out of that yet.
Maybe we can flip that, or
Yeah, well,
see if he-
why don't we put it to the end, and if he doesn't show up, I can, just briefly update
He
you.
sort of touched upon it somewhat, maybe not in great detail, but somewhat last time.
Right.
We provided this to you.
Right.
But it is a significant thing, actually, with the, so, okay, so we'll put 3 on hold, and we'll move up to number 4 right now. Update of the short-term rental bylaw, and maybe first Judy can give an update on the last working group meeting and where we stand in that process.
So we had a meeting last week, all of us, and I told you basically that the short-term rental work group has, it seems to be their consensus that they would like to see the Board of Health do a regulation as opposed to a bylaw. And at our next meeting, which is going to be probably next week, we're going to look at the regulation that I put together and the registration form in some detail and take their comments and suggestions for changes. And then the next step would be for us to bring that, take a vote with the committee and bring that to their recommendation to the select board. And then it would hopefully come back to the Board of Health for us to work on the regulation further, and we would have to have a series of public hearings and all of that. So really, since our last meeting, nothing has changed. I do know Bob has put a placeholder in the budget for funding of a full-time housing inspector and possibly administrative assistant.
That would be one time. Is that annual or one, I thought that's startup.
It would be in this year's budget, and then every year when he does the budget, he would either leave it or,
Adjust it.
yeah, or adjust it.
Based upon the revenue that it generates.
Again, that's all, yeah, that would be my thought, but we would see how it plays out.
So these 2 documents that we have here in your packet are the 2 documents that this work group will be going through with a fine-tooth comb at our next meeting.
So the difference between a bylaw and a regulation would be that as a regulation, we don't need the town meeting to approve anything except the money to pay. So all we'd be asking for the money, but we could have the regulation without the money, and we could all chip in to pay somebody to do it.
Right, so
10 hours a week per person.
Right.
the bylaw, if you needed to modify something, it's a process. So if you needed to change something or add something or beef up the registration form and the regulations, with the bylaw, you have to wait and go through town meeting again. With a regulation, we could vote and change it, so it works a lot better that way.
More flexible.
And I think, I'll just reiterate what Judy said, that so the working group, they pretty much seem to be, have a consensus that it should be done as a regulation, and then it would come back to us to do it. And Judy has already given them this preliminary registration form, and then a more compact regulation. So it's kind of registration plus, which,
It's a registration process and allow us to gather data and then to have a framework. Should we have to make adjustments, we can see what people are doing actually out there and have that information, the more detailed information than we get from the state. So,
Have we already gone through this?
no, we can talk about specifics some more, but
we'll have to, yeah.
the next meeting, I think the working group is going to sit down and go through this thing like we might do right now, the registration form and the bylaws, and make suggestions and discuss some things,
Right.
and then vote at that time, and that might be the last meeting. I think it's possible. So the process might move along that quickly. And so I guess, yeah, if somebody has looking through the short-term rental registration application and then the backup short-term regulation, if there's questions or issues to discuss there, let's talk about it. Dick?
Well, one, we had talked previously about the occupancy being 2 per bedroom plus a child. Now it's 2 per bedroom plus 2. So if that's what we want to do, then I think we should make it very clear that children are considered occupants. That it's 2 occupants per bedroom plus 2 additional occupants, and all children are considered occupants. So if you have a 8-month-old, it's an occupant, it's an
Exactly.
occupant. So you can't have a 4-bedroom house and have 10 people plus 6 kids under the age of 5.
Yeah, our definition of an occupant is any individual residing. Our definition of an occupant is any individual residing overnight in a short-term rental.
But
So,
people are gonna find that, they're gonna see that and then they say, but that doesn't count kids. So I think we should clarify it.
Say regardless of
All
age.
children of any age are considered occupants.
we
Well,
can,
maybe we just put that in with the definition of an occupant.
yeah, put that in
Right.
the
Just
definition
add
of it.
that,
In the regulation part of it.
Right.
Yes.
Yeah.
occupants
In the
including
definition.
children or something like that.
Yeah, that's a little lighter language than we had on the previous draft. It's just plain 2 per bedroom plus 2. And the other thing that's changed, significant thing here, is different language with the parking. And one thing that has come up that Judy mentioned to me is that apparently the town has a law, or I guess you call it a law, that you can't overnight park on a residential street.
Yeah.
So
that's-
that is a town rule. So this, when we say it in this language, it's not some wild new thing, it's already in the town laws.
And I don't know that it's enforced on private roads, but if there was an issue, where they were blocking fire lane, there wasn't wide enough to get cars, the fire trucks through or whatever, it certainly would be enforced, so. And this gives us, again, that framework to do that.
And this revised parking definition was taken from one of the other towns' bylaws or regulation. I think it was
I
Yarmouth.
think it was Yarmouth, yep.
We read that, we said, oh, I like that, we like that, because the definition was gonna be something we gonna have to wrestle with anyhow.
Now, just to be a nitpicker,
Oh, not that you,
we say you can't park on lawns. If you don't have a lawn, if you have a Cape Cod landscape, you still can't park in the front of, so we want them to park on a designated parking surface, not on their, we say the word lawn, and then we say, well, we don't want anybody to have lawns anymore. And, so you could put 20 cars in front of the house, it's not a lawn. We're being good, we don't have a lawn.
I think
So
there's
how
gonna
can we
be some
word
more-
that?
I think there's gonna be more discussion on that at the short-term.
let's see what
group.
they say on that.
Right, I think that's hard to,
I mean, some people have
we can't get everything in.
dirt front yard or it's, that's
Whatever you-
arguable, and it might be open to inspection, interpretation at some point.
Whatever.
Exactly.
Whatever you come up with, there'll be a way to argue against it, you know what I'm
Right.
saying? So you have to let's see what the working group recommends.
And also, if someone sees 20 cars parked on, quote, the lawn, someone's going to call and say, hello, will you check this out, please? And
Right.
So,
And that becomes a complaint that then
Exactly.
is looked into, so.
And I think the no overnight street parking that we've emphasized already existed, but most people may not know that, but I think that's a big help in terms of the neighborhoods.
It is.
And I guess at some point, there'll be a process where we have to notify, the residents and sort of educate and all these rules, make sure people sort of become aware of them somehow. That's something we'll figure out later.
that'll probably be in the Chronicle or something with the rules, or hopefully.
Yeah, we'll have to do some outreach, and before we, as a Board of Health, to create a regulation, we have to, again, have public hearings, and I'm sure it will get some press, and
The other thing that changed with this new draft, rental fee was lowered to 125. We kind of softened a little bit, just partly from input back in the working group. 125, and also if there's 1,300 short-term rentals that we know about, and we don't know how many more might come in, but that comes out to $160,000, so that gets you towards funding some
Covering
business
costs.
for people. So that's partly why it was lowered. I think the Nantucket registration fee was $225, so this is quite a bit less than that town. That's a change.
And there were sentiments expressed by some of the members of the short-term rental advisory group that there shouldn't be any fees by virtue of the fact that the town is currently receiving revenue from the state that's collected as part of the taxes paid by renters. Okay? What are we getting, what was that slice, going up to 4 million or 3 million?
It's about, right now, about 3 million that comes in.
1 million
Comes in
goes,
on what?
No, it's
the element,
percent.
Percent.
So there's 4%, I don't remember all the breakdown.
Yeah.
1% goes to the schools, 4% goes to affordable housing, I
and
believe.
2%
The 2%.
general fund.
Yep.
So there were sentiments at this other group that the costs to run this program should come out of the revenue that the town is currently receiving, rather than be added to the cost of the owner of the property.
Well, that's a reasonable request, actually. I mean, the town, ask the town to use some of that money to support this program. It'll be beneficial to the town that we do this, and,
But the distinction is, and you learn things by sitting at these meetings, the people who pay that surcharge or that additional fee,
Tax.
the occupancy tax, are not the owners of the property. They are the people who are renting the property, pay that in addition to what they're paying. So if the house costs $4,000, the renter is paying $4,000 plus the state
6%.
the state tax. So the owner is not bearing any of that cost.
But there's only
But
one
it is the
annual,
owner who sends the money to the state.
exactly.
Correct.
Not the tenant.
Correct.
They're liable for collecting it
And passing it through.
and passing it on to the state.
Absolutely.
Right.
They're not paying it.
Well, some may be, and some are adding it on.
Does Carol know?
Isn't the 125 an annual registration fee for that property?
Yes.
Yes.
Okay, so it's not like every week or something like this?
No,
It's
it's one
an
time a
annual fee
year.
that's paid by the owner in order to rent out their property.
And the argument for charging a reasonable registration fee is if the annual rental property is generating $30,000 per year in revenue, it's not unreasonable to ask them to pay a low registration fee of $150 or whatever it is.
I think the registration fee is fine at 125, and I also think that it helps them adhere to the rules. If they're, if they have this application, they need to submit it, and they need to follow the rules, and if they pay a fee,
It
I think
means
it
more.
just makes it a little bit more responsible. I see
In-
nothing wrong with the
In
125.
in some iteration of this, there was a section that said these rules, or certain of these rules, need to be posted in the property. So the property is limited to 2 guests per, or this property is limited to 8 guests, including children. There shall be no parking on the lawn. There shall be no parking, so that there's no confusion. That the people that rent the property, when they come to the property, there's a sign that tells them what the rules are.
So,
Is that in this draft?
no.
I don't see it in here.
There was a lot of discussion about this being, with the working group, that it being just a registration process. But, so I tried to kind of scale it back to a shorter, more concise,
Simple.
less onerous regulation, just the basics. Start collecting the data over, the first few years, and then if we want to, or we feel the need to get more detailed and have more rules. As
This isn't a registration process. This is regulations regarding how they can rent their property. If
Yeah.
we tell them it's just a registration process, then
It's a
they'll say,
regu-
well, nobody told us we couldn't have 10, you know,
Well,
we just
as
registered
part of the
to collect
registration,
data.
they will be told that. I mean,
They'll get all the rules with this.
Right.
The owner will sign an affidavit in this registration.
Right, so it's
No,
not
no.
just a registration process, it's a regulation.
no, it's
that they
a
need to follow.
regulation, that's for sure.
And it would make sense to have a little placard in the property that says this property is rented to a maximum of this many people, and no parking shall be,
I thought we talked about having a certificate that would be, granted to, as you do your registration, you get, and you can put it up in your establishment or whatever. And then lots of times the owners will have a welcoming book or something like this, and they'll certainly, they should put the rules in there. And people do use that book a lot, so that would be one thing, if it's
Yeah, I
not
think it would-
spelled out in the
It
cert.
was left out of this to shorten it, but I think
Right.
it could certainly be part of the discussion when we go to make
Sure.
our final thing.
I
It'll
think
be up to us.
You can make an argument
And so
that
we
it
can,
would be
that's a,
reasonable.
I
Right.
mean, reasonable.
Judy's trying to keep it simple
Exactly.
and minimal, to try and get this thing through in a way that doesn't raise a lot of opposition.
how
I
will the
guess-
renters know that they're only allowed to have 3
Because
cars?
the
Sign a
owners should
lease.
tell them
That's
what they're
part of their
allowed.
rental agreement.
The owners should have those rules spelled out for them if they're going to be renting.
You're not gonna rent a house without signing something, a lease. And in that lease, it'll specify.
Say that.
Yeah.
Because I know we have a lot of things in our lease, and it spells things out, and
Right.
So do we need to say that this needs to be in the lease? What if they don't put it in the lease?
well, then they might get fined. if
No,
they don't do
no,
it.
they'll only-
I mean, if they don't adhere to the rules.
I mean, I think.
It's customary then.
My own opinion would be down the road when, after we get this approval from the working group, then we go to make our final draft. I think that's something that come up and say, we could just, we want to add in that you need to post, and we could do that.
To post the
But
rules.
right now, we're trying to keep it simple, so it's understandable. I just back up on one thing. So the fee, there'll be a startup fee the first year because you'll be collecting. But after the first year, for the town, the fee should pretty much cover the cost of administration. That's an important point for the town, I think. And then I think we should probably try to get more information about these taxes on rentals and short-term rentals from the state, because there's, we have to clarify in our own mind, I think it's up to 6% now, they added 2% more the town can take in. One of those percent is going to affordable housing, and one is going to the elementary school. And then there's a good bit of that money that goes into the general fund, millions, I believe. But it would be nice to know exactly what that is a little bit and how it's broken down. Because the argument that Dick made, I guess, if there's a startup cost, it's pretty reasonable to ask the town, out of the millions they're getting from short-term rentals back from the state, the fees, that they take a little slice of that, a little sliver, to help pay the administrative costs of this
The
thing.
first year.
That's a first year. So I think we can find out about that.
Well, that's the argument Bob Duncanson will make when he petitions them
Yeah.
for year one startup funding. He'll
But I
say,
think we might be able to get a little more information on just how much money we're talking about there and what the percentage
I've
breakdown is. what
scribbled
it's-
down, Jill talked about it at one of our earlier meetings. I
She
remember
did.
1% going to elementary school, 1% affordable housing, 2% general fund, and now I think they're increasing it from a total of 4
They added
up to
2%.
6%. And then it was like
But we should find out
1.7
what that
million
is.
per percent, or there's some rate, that each percent raised X amount of money. So,
The other things that came up, there was some comment when we saw owner's information. And you have to look into the regulation, but it gets very complicated, who the owner is and how many people and whether it's an LLC or a trust and all that. And that is sort of spelled out more specifically in the regulation in terms of owner, but there's always questions about that. And I think this says now that it's up to the owner to notify all their owners that they've signed this affidavit, and this regulation has come down on them. We're not requiring that they list all the various owners on this official form. There's just one person identified as the manager or whatever. The other thing that comes up is, and then I'll sort of throw it out, has come out is the contact person. The language here, says, quote, "who is able to respond in person to any issues or emergency that arise during occupancy within 1 hour of contact by the town's health department or police or fire department." Now, I know in the Nantucket regulation, they did have it was a 1 or 2 hour in-person availability of somebody. So that's an issue that owners get into if they're not here, or do you have to have a rental agent, or can you do it by phone call, or can it be handed over to a neighbor? But that is something that will probably require some more discussion or thought, I guess. Judy, do you have a?
Yeah, I think, 1 hour could be a little bit onerous. I mean, I think we could change it to something like 4 hours or 8 hours, and, we would have email and emergency contact information, so I think someone wants to know right away if there's some emergency, public safety emergency at their property as well, so we have a way to get in touch with them, and we're asking them to get back to us.
You have phone
as quickly as
contact within
possible.
1 hour, and then in-person contact with some more liberal, 4 hours would capture someone living in a big area, so
Right.
you could have phone contact within an hour, and then in-person contact could be another number, I guess.
Yep,
Response time, yeah.
I guess the issue is if the water heater bursts and the house is being flooded, waiting 4, 6, or 8 hours to call somebody to find out what plumber you're supposed to call.
Well,
Doesn't make a lot of
presumably
sense, and you wouldn't
the
call
renter-
911 normally if your water heater burst.
The renter owner has, I'm sure, most of them have a contract that specifies that, because that.
Right, but the occupant doesn't know that.
Well, they should.
With the,
Oh, so there should be a list of, if there's
Oh, I see.
if there's an electrical problem, call this electrician, if there's I don't think I've
They
ever
have-
been
or
in a
contact number of the owner.
rental that has
I
that.
mean, when,
The rental agent.
You call the rental agent, but we're saying it
Or the
could
owner
be
by
6
phone.
hours to get in touch with the rental agent.
No, by phone, within an hour.
yeah,
Yeah,
no,
I mean,
we'll
I
have,
think
we'll
it's-
have 24-hour per day contact information, so that if something happens, then we'll be able to
Be able
get in
to
touch
page
with them.
somebody, not page them, I use that word again, call.
Carol, did you have a comment?
no, I was just saying that, there's usually someone that you can contact. That
Exactly.
the owner tells the neighbor or whatever, or tells the renter, if something happens, call blah, 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 or call
Right.
us, and we're
24/7.
there 24/7, on the phone, and call the plumber, and
So we're just saying that needs to be in the regulation, that there has to be
But
something.
we're not regulating that. They already do that.
right, they have a
Well,
contact number is what they have.
It's in here, it says if different from the operator, the name and contact information of the operator must be provided along with the name and contact information of the operator's agent if different from the operator, who is able to respond in person to any issues or emergencies that arise. So maybe we don't need to have in person during the occupancy within 1 hour of contact by the town's health division or police or fire department to complaints regarding the condition. This is, again, it's just somebody that we can contact and know that they're gonna be available right away to
He should be, it's their
respond.
property, right?
Right,
They
and I
better
think
wanna
that's
come.
not unreasonable, most people have that in their contracts anyways. Anytime I've ever done an Airbnb or anything like that, you have a contact information, usually a cell phone number, so.
Right. Well, maybe we let the short-term working group go through and make their suggestions, and then it comes back to us, and then we do the final workup from there, taking into account their recommendations and any others that we may have.
I think that sounds reasonable. I think that's what we're doing today, is just having a preliminary, little further discussion about the specifics. And then the working group will look at it again. And I don't think they'll probably, well, I won't say. So any other comments or, okay. All right, I think we know where we are there.
There's
And
a
I think this working group is moving along. Comments from the public?
Yes, Gloria?
Yes, thank you. It's Gloria Freeman. I'm not as optimistic as you are as to where the working group is headed. those who have a vested interest, either by handling rentals or individuals who own rentals, are the most vocal at these meetings. They're the ones who really dominate the conversation. And my impression is that they have the votes. And while they are open to a registration form, they don't want it linked to your regulation or that there be a fee. Judy and Dr. Hanson and Member Beckley are doing a great job, but I don't think they have the votes. I also want to say that this group does not want parking restrictions. I'm just wondering whether more members of the board should be at the meetings. Not that you can vote, but that you all speak with one voice. You have the authority to implement a regulation with or without the working group. It's been very interesting watching this whole process, and I want to wish you all a very Merry Christmas and a Happy New Year, and thank you for all your work on this very important project.
Thank you, Gloria. I think at the last meeting, a few of the people that hadn't spoken up, Crespo was one, Kim Burson, another, and they did, as I recollect, I didn't take account, but they were for the registration and regulation, so we'll see how that comes out. And I would also emphasize that there is a consensus that it be done by regulation, and we're a regulatory board, so we can proceed on our own authority and go ahead. And I think we had deferred to the working group and the select board to get more input, but you know, I think we're already working along on our own, so we'll see how that goes. But Judy?
We need to let the process work itself out now that we're in it, and see what happens at the next meeting. And I know that they feel less is more at this point as far as just collecting data and not being overly restrictive, but I feel like we can't really have a registration process without some type of a backbone of some regulations for them to follow. So that's where the Board of Health is going to come in.
Yeah, I think that's right. I think Judy has said that it's a registration, but it needs some regulation behind it to explain it and to define the terms in it and so forth. So it's kind of a package, registration plus is the way it's being put forward.
This board never considered this as just a registration exercise.
No.
And the advisory group is an advisory group, and they can advise us. But if they advise us that they don't want regulations, then we can ignore that. We can take that under consideration, and then we can consider it, and we can decide to have the regulations regardless of the vote of the working group. Because if the working group is dominated by people who either own and rent properties or have relatives that own and rent properties, that was something that I was concerned about from the very beginning.
Right.
And we're letting it work through, but if they vote that they think that all this needs to be is a registration exercise, then at least I would not accept that.
I think we have some pretty open-minded people on the committee, and a lot of them just feel like they don't want us to solve a problem that doesn't exist. So they want to see data. They want to make sure that there is a real issue before we jump into this. But I think that as a Board of Health, we deal with this every week, it seems like, some type of a bedroom or issue or rental issue. We get calls at the health department that we can't really follow up on because we don't have a framework for following up on it. So that's where we're coming from, and part of this will allow us to collect data and follow up on complaints. And then once we do this for a few years, we're really going to know where we stand. And
And to
hopefully
say
we'll be
we-
able to get some of the other committees in town to be supportive of this, like the Finance Committee. And, you know, this, I think, is going to help the town as far as our affordability problems in town with housing. I think it can only help to know how much of our town is being rented out short-term. And just this will provide us a framework for collecting the data we need to really know what's going on.
The argument that no problem exists is not appropriate. We
But
can go to
it's-
VRBO today and find a 5-bedroom house advertised as, it sleeps 20 people, collects $28,000 a week and is fully rented for 20 people all next year. And I can find numerous.
And that's
cases.
true,
So
but-
there is a problem.
Yeah.
That's a problem. And to say there isn't a problem, that we're just, spinning our wheels and trying to make
And-
trouble, is not appropriate.
And for us to go the route of exclusive registration would not give us any authority to address that very situation. And so I agree with you that at a minimum, whatever we promulgate has got to have occupancy standards. It's precisely so that when we learn of these overuse, over rentals, we have the basis for Judy or staff to go in and say, you can't do this. This is a violation. Right?
Yeah, and I'd say that the first paragraph, purpose, under the short-term rental regulation, the preliminary draft that Judy made up, the purpose kind of broadens what our aim is and what our authority is, puts it more in our ballpark, I think. And it's three-pronged: to protect the health, safety, and welfare of occupants, ensure that the properties are being used in a manner that will not stress the town's water or sewer infrastructure, and then not negatively impact quality of life in the residential neighborhood. So that purpose is broad. I think I think we can make
It's a
the
good
argument that
statement.
that's why it falls into the health board's
Purview.
purview. And then, we had said a couple of meetings, I had said that registration alone with nothing else, I'm not interested in. It doesn't do anything, actually. It's just kicking the can down the road and for another day. And the tough decisions you'd have to make then, we can make now as well. So that's been, and there wasn't a lot of pushback about that, so I think that's the way we're going. We're pushing. So other public comments or board comments, discussion? Anything else on the public, Judy?
Now, Dr. Duncanson wanted us to de-emphasize the water aspect of this.
No.
Because he said
No, he's-
that we're not doing this because there's an excess load on the water system. We should not concentrate on the septic and nitrogen loading side of it, because, the water issue is not that great an issue, and there's gonna be more wells, and there's gonna be more tanks, and, so maybe we should just reverse septic and water, not put water first.
Well, I think he made some comments that was in the context of a lot of other discussion, though. So I think we can get it right from him next meeting and sort of further that part of the discussion, it seems to me. Other comments or at the moment, or should we move on to the next?
I'd move
We
on.
have one hand, Ann Ryan is,
Oh,
Ann is on the committee.
Right.
On the working group. Ann, did you have a comment?
Yes, hi, thanks, Judy. Yeah, I just wanted to say, I am the Water and Sewer Advisory Committee member of the working group, and water is a big problem. And that's definitely an important consideration in all of this, as well as the septic system being overloaded. Because septic systems, as you know, are designed for a certain number of people that were anticipated to be in the home. And if it's overloaded, even just for a short-term situation, what happens if you overload it? It's a problem. So that's just my 2 cents about it.
okay, good, thank you. And actually, in answer to Gloria, having more members of the Board of Health at the working group, then we get into the quorum thing. where we're having a discussion, and so I think that's why we limit it to two. It's like a subcommittee.
I mean, you certainly can listen and,
Yeah.
Can you
Can you call, could someone call
call
in?
in on it?
I don't know.
Just view the tape.
yep.
Okay, all right, good. Well, that's, I think, a good discussion. So, and Dr. Duncanson's not here, I guess, so maybe we can move ahead to number 5, update John McGrath, 32 Mill Hill Road. And I guess, Judy, I'd ask if we have some,
So I, excuse me, I did have a call from our DEP task force who's been on this with us today. I reached out to him last week. He said he's drafting the notice of noncompliance. He started working on it with his section chief. He's having he hasn't been able to get it up to the supervisor, the head, to sign off on yet. They're just so busy, but he is working on it. He said that the notice of noncompliance will have schedules and deadlines. It will be issued to John, and, we're hoping, sometime at the beginning of the year.
this is Michael Whiteside?
Michael Whiteside, yeah. He
And-
did apologize because he knows that he's holding us up.
Did he put a date on it, did you
He
say?
did not say. I said, so hopefully in the first week of January or so, and he said, yes, he's gonna push to get an answer as soon as possible.
Did I hear what I thought you said, which is when he receives this notice, the single notice is going to lay out what his obligations are?
Yes.
The time frame within which he is expected to address
Yep,
violations and the penalty assessment
I'm
protocol
sure
to
we'll have all
follow?
that, yep.
Okay,
Schedules and deadlines, and then I'm sure it will list the penalty part of it.
okay.
As any good order.
So this should be a very pivotal notice.
It will be strong language. He did say that he gets no response from John directly. There is a friend of John's who does occasionally touch base with DEP but besides that, he gets absolutely no response from John. He does not answer emails or
No response from Mr. McGrath?
from Mr. McGrath,
Yeah.
no. So,
I was just wondering when we might think about reclaiming responsibility and for the McGrath cleanup, that, DEP has certainly given us all the ammunition we need as far as documentation, and we appreciate their efforts, but I'm just wondering, in the end, it's going to fall to the town to clean it up. And we know in May, it will be 14 years, which is unbelievable. And we know that John has a history of not responding to anything. And so it's very, very likely that he will take these warnings and tear them up and say whatever. But I'm just wondering if we should start thinking about when we take back that responsibility. And the town already voted monies for it, so.
I
Yeah,
think
I
we
would-
wait and see what this,
Yeah, I would say, I wouldn't put it in terms of, we haven't given up any responsibility.
Right.
I think we've given the Mass DEP a chance to respond and become, and participate, and it sounds like we're pretty close. So I would kind of say at this point, I wouldn't be in favor of sort of reversing what we're doing. There is a delay, but we do have the roadway cleared up, so that's
Yes.
a lot of progress.
It is.
Michael Whiteside, he did say, and I think I heard this, I may be wrong, but it's more complicated than you think if you go in to clean everything up, because you get into issues of private property and family heirlooms and this and that and whatever, so it's not, so that, he just said it is complicated to move in and do that, he just warned. So I would be in favor of kind of, holding off on this, we've kind of given it a good bit, but I agree with you. We haven't given up anything. I mean,
Right.
we may at some point do what you said. I had one other question for Judy, and that is, have they put the no parking signs all the way down to Dusty Miller Road? They're supposed to do that, and then Mr.
don't
Andy
know.
Goddard said that once those signs were up, I think he told me that he would then contact the neighbors, notify the neighbors, and then begin enforcing parking. So that was, 4
I
months
don't know
ago.
if they've put them up
Can we
yet.
can we
I
check back
will-
with Andy Goddard and see
Yep.
where we are there? Because what you'd like is to get the signs up, have them notify the neighbors, and begin enforcing parking, because that issue may come up there.
I will follow up on that. The last time I was up there, I did not take note, so
Yeah, well, this is just from memory, which is,
Yeah.
so I can't say 100% what he said. This is what my recollection is.
No, that's correct. I mean, they needed to get the signs up and then, I think it might be the other way. They needed to notify the neighbors first and then put the signs up.
Yeah, but I think Andy Goddard was the police department has given him, he's the point man from the police department on this issue. So he's the guy, I believe.
I will reach out to Andy.
Other comments or, okay.
All right.
All right, so and then we'll, okay, move on. I guess update COVID-19. Dr. Duncans is not here. If Judy has something that she can share with us.
I don't
or
have any
not.
statistics. I do know that, believe it or not, our positivity rate actually dropped last week down to 9. It was up to about 11 or 12. That's your presented positives of the number tested. It's still above where you would like it to be, around 5. I mean, obviously, we all know that we have a triple epidemic going on, right? With the RSV and the flu and the COVID. It's everywhere. We just ordered 3,000 more test kits from the state. They will be coming. People are coming in a lot to get them. Diane spent a good portion of today giving out test kits. I think, was there a call that went out around town?
Not that I know of.
Okay, so.
I did not hear one.
It was in the paper. We've been trying to get the word out, and it is getting out there. So people are coming in droves and just picking
know,
them up.
One of the things I have heard the CDC recommend that I don't think the general public is aware of, and that is irrespective of people's vaccine status. With all the free testing around today, every household in America who's planning any kind of family gathering should adopt a policy to have everybody get tested before they show up at the Christmas dinner house or the New Year's party or whatever, that we convey out at the public health message that testing by family members planning to gather should be part of standard thought.
I think that, we've said that the past few years. This is year 3 of this, and I think that's a good recommendation.
Could we post something on our website perhaps, and then couple that with the continuing availability of free tests, but try and push our public towards having everybody that's planning to come over for Christmas dinner to be tested. Takes 15 minutes,
Yep.
no cost.
We can try and get that out there on our website and in the newsletter that's put out every Friday. Actually, yeah, would be
That's a
fine. Yep.
great idea.
So,
A little
write something up.
box, a little,
Yep.
you know.
And then they also recommend if you have small children, young, especially babies, don't be passing them around, and because we could be carrying the RSV and pass that to a small child easily, and we have little to no symptoms. So the hospitals are quite busy. I guess Cape Cod Hospital's not too bad right now with the RSV, but the hospitals up in Boston area are overrun with it. So it's an issue.
We're passing out all of these tests, and people are taking these tests, and a lot of these tests are positive. I know 3 or 4 families that are positive now. None of them report those data to anybody, so we have no clue how much COVID there is. We know the COVID in the septic system in Boston and the sewers is gone way up again.
Wow.
So there's a lot of COVID around. People don't want to hear it. You can say these things. I just got back from a vacation in the airport on the bus. No, I think we're the only people wearing a mask in the airport. Nobody wants to hear it.
Right.
And then people like Ron DeSantis and others are going around saying, well, most of the people who are getting COVID now have been fully vaccinated, so the vaccines don't work. Don't bother getting a vaccine. 60% of the people in Cape Cod Hospital with COVID now are, quote, fully vaccinated, meaning they've had the initial vaccine. Well, statistically, that doesn't mean anything. That doesn't mean the vaccines don't work. You know, you've got a very high proportion of the high-risk people are vaccinated. A very, very small proportion of those people get COVID, but those are the ones that show up in the hospital. And so then people say, oh, all the people in the hospital are vaccinated. The bottom line is, if you get vaccinated, if you're 70 years old, you've been vaccinated, you have about 10% the risk of getting severe COVID as if you're not vaccinated. But you've got Ron DeSantis and others going around saying, people vaccinated are getting COVID, so don't get vaccinated. It's dangerous. In fact, vaccines make you more likely to get COVID, is what they're saying. And we've got half the population or more listens to this stuff and believes it.
Yeah.
So you're putting up a sign saying, you know, you should take a COVID test before Christmas dinner, you know, people are going to say, gee, I went on the internet and I hear that, you know, there is no COVID.
There are a lot of people that are doing that. They're coming in for these kits because they, you know, so it does become very political.
There are believers.
Yeah.
And there are non-believers.
And so all we can do is keep giving people the CDC message, which is to do the right thing, to test yourself. Don't go out if you're sick. They're recommending people wear masks if you're in crowded places again. All of these things are known to help you from becoming severely ill. So that's all we can do is keep pushing that message. So, and we're trying.
I think the main street that you mentioned, the paper that comes out every week.
Right.
Putting a little blip in there.
Yep. I definitely will do that.
Any comments from the public on COVID-19?
I don't see any.
Okay. And, all right, that's ends our items.
Do you want me to talk about the Title V just briefly?
Oh, sure.
Variances?
Yeah.
We had it on the agenda for this week, but Bob did just briefly talk about it last week, and I wanted to just bring it up again in case anybody from the public wanted to ask questions. So basically, the DEP is looking at revisions to Title V in certain watershed areas, mostly on the south coast of Massachusetts, that would require towns to require citizens to put in IA systems or come up with some type of a plan to remove nitrogen in those watersheds. So in Chatham, we already have a comprehensive wastewater management plan. Bob has been working closely with Pleasant Bay Alliance. This is all just in a hearing stage right now. They're taking comments. They were supposed to have comments close on December 1st. They were overrun with comments and people wanted them to extend that comment period. So now it's extended until January 30th. But in Chatham, we feel confident that we'll be able to build upon the work that we've already done in the past, 20 years on our comprehensive wastewater management plan and come up with a plan so that we won't be requiring people to put IA systems in. I'm certainly not recommending that anybody do that out of precaution if they're updating their systems. I think we need to wait and see where this goes with the town and the state, so.
So this watershed permit that's mentioned here, is that a new permit that hasn't been started yet?
Right.
Okay,
So you would need a permit, they're saying you need a permit for each watershed in your community. But I think some towns, including Chatham, are arguing, well, we have a comprehensive wastewater management plan that should cover all of our watersheds because it covers our whole town. So those are the types of comments. Apparently, Bob is working with Pleasant Bay and they've got like a 15-page thing of comments that are going to the state.
Yeah.
I mean, if you look at this thing, it could really frighten you because when you look at this, it says, okay, every house on Cape Cod has to have an alternative system within 5 years.
Right.
If you read this thing, and that's absolutely totally ridiculous.
Right.
And it's impossible.
Right.
Even if you said everybody had to have an alternative system, it'd take 30 years to do it. And we already have a sewer plan. We're spending tens of millions of dollars to put in sewers that are going to meet the requirements. So for Chatham to worry about this
It's ridiculous.
doesn't make any sense. But if you were living in a town that didn't have a sewer system, then this would be very worrisome.
Right.
So is,
So they can, as part of this, instead of going the individual IA system route, work on watershed permits. So, you know, a town like, I don't know, Eastham or something, they would work on a plan and say, you know, in this watershed, we're gonna have 30% IA, and we're gonna do some sewering. They come up with a plan that would meet the requirements of the state. So, but again, this is something that's, I think is gonna be virtually impossible to do in 5 years, so.
is all of the Cape in a nitrogen-sensitive area, quote-unquote?
The South Coast embayments, yes, so, yeah, pretty much everything on Cape Cod, and down through, the South Coast of Massachusetts, like Dartmouth, and, there is a website, it's in this, that you can go to, if you go to mass.gov and do Title V, revisions, it'll bring you to their website, and it has a lot of information.
If we don't have enough,
And here we are, Bob's the expert
if
on
we don't
this.
have enough engineers to install.
Where's the hook?
Oh, my goodness.
He was going, I'm gonna make sure Judy's not saying anything wrong.
5 minutes later, you would have ducked it.
I want to know if we can show that we're making quote-unquote reasonable progress towards reductions in order to get a watershed permit.
Yes,
All right.
yes. As I'm sure Judy said, we've had our comprehensive wastewater management plan since 2009. We have been having conversations with DEP and are trying to make the case to them that our watershed plan, our comprehensive wastewater management plan should serve as our watershed management plan. As you know, Chatham and the other 3 towns around Pleasant Bay, we had the first watershed management plan approved in the state.
Beautiful.
So we know more about it than even some of the folks at the state do. And based on what's in a watershed management plan versus what's in a comprehensive wastewater management plan, there's probably more in the comprehensive wastewater management plan.
Okay.
And so we're trying to convince the state, and I think we'll be successful because we're not the only town. There's a couple others that are taking the same approach. That look, guys, we've already done everything you asked for us to do. You approved it. We're 10 years into implementation. It makes absolutely no sense for us to stop and go back and do things over again.
Right.
You know, and the other thing that I'm very concerned about, and I'm sure Judy alluded to this too, is, you know, we don't want to poison the public support for the CWMP.
Right.
You know, we've had very good public support. We've had unanimous votes at town meeting for upwards of $150 million so far. And the last thing we need is for the public to get confused over, oh, now I have to put in this innovative alternative septic system, and then 10 years down the road, the town's going to tell me I've got to trash it and connect to the sewer. As you know, we provide people that put in IAs 10 years of grace period. So we don't want to do that on a a town-wide basis, if you will. And then the other thing that I think, you know, Dick was alluding to, there aren't enough engineers or installers to, you know, have every town in southeastern Massachusetts require IAs within 5 years. And, you know, there's been some articles in the paper that, you know, have indicated that the state's using that as a stick to force towns to the watershed permit route. And that very well may be true, you know, that they themselves realize that, you know, 5 years is just, I mean, I had conversations with DEP last summer. I was one of the first people they approached about this idea of these 2 reg changes. And when they told me, the first thing I told them was 5 years is never going to happen. There aren't enough engineers or installers for 5 years. So, you know, I expect that to change. But they did extend the public comment period up until January 31st next year. And there's actually been a recent request to extend it even further than that. Pleasant Bay Alliance, we have about a 12-page comment letter that's currently undergoing review again now that they extended, because the deadline was originally supposed to be last Friday. We're going to be reviewing that again, and once that's done, I will be more than happy to share that with this board and with the Board of Selectmen. Sorry, with the Select Board, because I think it'll pretty well outline all the issues that we've identified, both with the watershed permit and with the Title V, because those 2 are linked right now.
The best response for our residents should be to feel good about what they've committed to in the past.
Absolutely.
So that we don't have to wrestle with some of these issues that other towns
Right,
you know,
right.
because they didn't act as
Yeah, as you know,
proactively as we
Chatham,
did.
you know, and people tell me this all the time, you know, Chatham's ahead of the curve, and I'm like, yeah, we are ahead of the curve,
Right.
and have been ahead of the curve. So we should not be penalized for being at the head of the
Exactly.
curve. So,
Right, Chatham is well along in the sewering process of the town. There are other towns in the Cape that really haven't even started yet, I understand. That, it seems to me that this is gonna be a hammer to those towns.
Yes.
That hopefully you'll have a defensible plan that they'll say, okay, you're doing great.
yeah, yeah.
All right, interesting.
But it looks like when this notice first came out, the public input dates had already passed, and so they had to revise it?
No, it had come out earlier this fall. There were a couple of public meetings. There's now scheduled 2 more public meetings in January. And, you know, the other thing that we tried, and this is more for you guys, for the Board of Health, the other point we tried to make to them is, you know, you're requiring innovative alternative technology. Everybody put in IA systems. Well, IA systems aren't that good. You know, they're good. They're better than a standard Title V at 35 milligrams per liter. But the state currently only requires an IA system to get down to 19. We determined 20 years ago that we need levels around 1 to 2 to protect our embayments. You know, the treatment plant treatment plant was designed for 3. That's state of the art kind of at the moment. It's running at 1.5 to 2, which is a great testament to our operators. So, you know, that's where we really need to be. So you put in all these IA systems, they may not solve the problem, and then you have to go back to the voters or the residents and say, well, you have to do more. Makes no sense. Makes no sense
Well,
whatsoever.
the language here says upgrade to the best available nitrogen-reducing technology. Well, isn't that constantly evolving?
Yes.
Yes.
So that's pretty hard.
And unfortunately, it hasn't evolved a whole lot in the last 20 years. I mean, when we started our CWMP, we were talking 19. You know, there was some technologies that were being touted around 10. Honestly, they haven't kind of lived up to their expectations, especially in seasonal communities, because it takes them 4 to 6 weeks to 8 weeks to kind of get to that level. So if it's a seasonal house, it's only used for 2 months in the summer. It barely gets up to where you want it to be when you're shutting it down again for the winter.
A standard septic system effluent would be expected to have what level?
35 milligrams per liter total nitrogen.
35.
Yep.
So an IA will knock that down,
To about 19, so roughly half,
right?
50% reduction.
But you're not even a fraction of being down as
Yeah.
low as you need
I
to
mean,
be.
then, you know, keep in mind that that's the physical system, and then you've got some additional treatment as it percolates through the ground till it hits groundwater.
Okay,
So even 19, you know, when it hits groundwater, is going to be lower,
okay,
but it's still not going to be down at 1 or 2.
right.
I mean, we're putting treatment plant effluent out at, say, 3. It's going through 40 feet of Mother Nature before it hits the groundwater. So it's probably down around 1 by the time
Wow.
it gets there. You know,
The Massachusetts Test Center, Septic Test Center up at the military base, Brian Baumgartel, he's got some grant money to start putting together a program to help communities with IA systems, all phases of them,
Right.
design, implementing them, and following up with all the testing requirements. So, you know, that may be a help to us, and maybe not so much us because we've already gone through it, but other communities that are going through it as this evolves, so.
Any public comment on this issue or any other comments from the board? Okay.
Okay.
Good.
We already
Minutes.
talked about COVID,
okay?
so.
Minutes?
Just remember, if you're going to Philadelphia, Philadelphia's now requiring masks in schools again.
Oh, wow.
Is that
Yep.
right?
We're seeing mask mandates come up again. LA County is considering an indoor mask mandate. New York City is considering an indoor mask mandate. And as I said, Philadelphia school system is now requiring it for 2 weeks after the end of winter break.
What about China?
China's actually finally relaxing them.
Yeah, there's no plan.
You know, which on the face of it makes sense because their zero tolerance policy, you know,
Just
What do you do? Continue that forever? At some point,
Yes.
you're going to end it, and then all of a sudden, you're going to get a slew of COVID-19
Wow.
because
Which is
nobody's got
exactly what's
vaccine
happening.
and protection.
Based upon what I read, that country's in serious threat of like millions
Yeah,
of deaths.
yeah.
Well, they have a relatively low vaccination rate, and their vaccine isn't
It's not
very
as good. Yep.
You know,
Yeah.
so they've got a high proportion of unvaccinated people. They've got a very high proportion of elderly
And they're-
people who are not vaccinated.
Yep.
And they're condensed.
So they're really in trouble.
Yeah.
Do we have to
Okay.
approve the minutes?
So
Yeah, let's go ahead and approve the minutes. We have minutes of November 21st of our meeting. Any comments or additions or corrections?
I'll make a motion, we accept the minutes of November 21st.
I'll second.
In a second. Okay, all in favor, say aye.
Aye.
Aye. Opposed, say no. All right, so they have been approved, November 21st. And then we have minutes of December 12th. That was our follow-up meeting from the working group. Any comments, corrections from that?
I'll make a motion, we accept the draft minutes from December 12th.
Okay, and we can take a vote, a voice vote to approve. All approve, say aye.
Aye.
Any opposed? All right, so the minutes of December 12th are approved. And if there's no other comments or further business, then we can take a motion to adjourn the meeting.
So move.
Second. Okay, and by voice vote, approve the meeting, say aye.
Aye.
Opposed, say no. All right, so the meeting is adjourned.
Thank you, everyone.
Ba-da-ba-ba